soup of the day.
Soup of the day?
Yeah.
For 2 years, Julie's shielded from the world. She has a muscle wasting disease and is clinically vulnerable. But now, COVID has found her.
Well, I had the cold-like symptoms at home, a lot of coughing and things. Then I were like I fainted, and then like when I came into hospital, it did get a little bit worse, where just the breathing side a little bit.
Julie's doctors say she's alive because she's been vaccinated. But not all of the Royal Preston Hospital's 125 COVID patients are. The variants driving this summer surge might not be making patients as seriously ill, but these variants are more transmissible. And with every patient who ends up in hospital, well, that's more pressure all the way through the system.
I think the lady wants some help with the oxygen mask.
For Dr. Mohammed Munawar, it means another one of his beds is taken.
That means each of those areas, other patients cannot be admitted and treated, and patients have been waiting for a long time already. So their procedures, their treatment is once again getting delayed. And that is putting a lot of pressure on the system and on the restorative work, which has started very well.
Here in the northwest, they've seen a rise of between 50 to 200% in COVID infections in recent weeks.
She's coming.
Around 500 of the hospital staff are off sick with COVID-related absences.
This patient is going to go home.
And this at a time when the hospital's emergency department is struggling to cope with a sheer number of patients coming through its doors. Summer or winter, the pressure is relentless.
For the past 2 years, we've always thought it can't get any worse, and then it does. And each time we think it's as bad as it possibly could be, there's something else that comes along on top of it. What we've found at the moment, with a combination of factors coming through, is that we're just having to work harder and harder and harder.
Some more?
Every wave brings pressure. Even mild COVID has consequences.
When these things happen and you think, should we really be, this kind of lackadaisical about it, really? I'm not sure. I don't know.
The government says we must all move on. But this is what living with COVID means to Julie. Ashish Joshi, Sky News in Preston.